Hi, my name is Iannielli, and I'm male to female transgender. I haven't done a video in a while, so excuse me if I feel somewhat not spontaneous enough. I'm doing this all off the cuff, but I think it's important to do these kind of videos. Um, I also hope that I share my story and it may help others that are going through similar situations. I've been transitioning for quite some time now. This is my 6th year. I am just about to take my estrogen or estradiol. I take, this is my estradiol. I'll show you what it looks like. It's kind of cool. They're small. My estradiol, I take 3 of these, and they're, just a little pill. It looks like a blue or green. So I take 3 of them, and I used to let them dissolve under my tongue, but I don't know if that really helps, but I just swallow it now. And I'm taking it with my orange vanilla Coke. It's pretty good, actually. I can't swallow that last one. Okay, 3 of my estrogen pills now. Stuff is good. And then this is my spironolactone. Spiro is used to suppress the male hormone testosterone, since when we're born, in my case as a male or boy, I have testosterone in my body. So I take the Spiro to suppress that and let the estrogen or estradiol take effect, because this is the estrogen that women need to develop as women, female, and this helps us as transgender women. I noticed some good changes. 6 years is a long time, actually, but my face has become somewhat more feminine. There was a point when I was thinking of doing facial feminization, but it comes with a hefty price tag, and it's not covered by insurance for the most part. So it's one thing I wished I could have done, but I can't. So I have to accept that. I also wanted to do breast augmentation, but I'm pretty happy with the results of the estradiol. And also I can pad it if need be. But I'm like at an A cup. I guess if I wanted to, I'd like to have a B. So I'm pretty okay with that. I think that my biggest hope is to do the bottom surgery. The bottom surgery to me is very important because I want to feel complete as a transgender woman. I think it will be a long road that I've come to integrate into my transition. I wanted to have bottom surgery for the longest time. Even as a young teenager, 16 I believe was when I really started to feel that desire more than I ever did. And I think the fact that I had to postpone that surgery twice already makes me want to have it even more now. I am in touch with my surgeon, Dr. Rajveer Purohit. Can't pronounce his name, but he's a really nice guy, very smart, very good rapport I have with him, and he knows how important the bottom surgery is to me, the vaginoplasty, and we're working together. I did have approval actually last year with a great team of surgeons, Dr. Rajveer Purohit, Dr. Jess Ting, and Dr. Marcy Bowers. I mean, you can't get any better than that. The problem was I went through a deep depression, and I did something that I regretted due to family pressure. I used to have long hair down to my shoulders. I look very pretty. I'm not exaggerating. I was very comfortable with how I looked, and I was pleased with the feminine features and the development. The problem was I was hearing pressure, or I was trying to figure out how to address things within my family relating to my son and my sisters, my wife. And I felt guilty what I was doing. I didn't know, but I've been doing it for now the past 6 years. So it's not like you just all of a sudden stop. I did make the mistake to get my hair cut. And when I got it cut, my stylist saw that my hair had patches of blonde and brown. So she couldn't let me leave like that. So she dyed my hair brown again to its natural color. And when I looked at myself in the mirror, I was so sad and depressed. I felt like my life had come crashing down. Now I had to wear the men's clothes again because I did not look like a girl anymore. It really sucked. Those 2 weeks were terrible. I went actually to Walmart to buy a pair of men's trousers and those oversized men's shirts, which I just detest wearing. But I had no choice anymore because I didn't look like a girl anymore. So I was deathly afraid to go out in public wearing a dress with short hair. I know they say that women have short hair. And even though my face looked feminine when I had long hair, it didn't look so feminine now with the short hair. And I was now very self-conscious. about wearing anything feminine. And it really tore me apart inside. So I called my psychiatrist and I said, look, I don't think I can go through with this surgery, and I'm going to need to call my surgeon because I'm just not up to doing this vaginoplasty when I don't look like a woman anymore. That was the second time I had to cancel the surgery. The first time was the year before that. And the surgeon that was scheduled to prepare for the surgery with me had discovered that I was in a psychiatric hospital a month before the surgery date. So his office called me and said they need to postpone the surgery for at least 6 months, and that I had to get the letters again from the therapist and psychiatrist that I see. So I was very disappointed, but I guess I knew where they were coming from. So now I'm working towards doing this surgery for real. I know my hair is not long like I want it to be, but at least now I don't feel self-conscious to the point where I can't go out dressed like a female. Now I wear just women's clothes, which I'm very happy about. When I was wearing guy clothes, I just didn't like it. I felt trapped like I did in the past. I did this for 50 years. I didn't want to do it anymore. So it broke my heart. But now, as I see my hair growing, and now I can put little bows in my hair and wear pretty dresses, I feel much happier. Though I do wish that it will be longer eventually. I wanted to get down to my shoulders again. But I'm passing okay. I haven't had any problems with that. And I like when people address me as Ms., Miss. So that makes me happy. I like to watch the male to female transition videos. The only thing is, when I watch these girls, I'm like in awe that they look so beautiful, so feminine. They're knockouts, they're gorgeous. And here I am, trying just to look pretty. These girls look like models. Perfect facial features, perfect curves. They look amazing. You wouldn't even guess that they were born male. Me, I don't know. Like when I go out, I sometimes wonder, do people just look at me and assume I'm a female? I would like that. I've had people tell me that I look like a woman, that they would never have guessed that I was born a male. So that's validation. I like that. But like I said, when I watch these girls in their own videos on YouTube, I'm very struck by it, to the point where I feel somewhat jealous. It's not a good thing to be. But when you see these gorgeous women who were born like you as a boy, blossoming, truly blossoming into gorgeous women, you can't help but wish that you could look just like that. I'm not advertising for orange vanilla Coke, but it is good. If you haven't tried it, you should. I like it. The problem with this, though, is it's new on the market, so a lot of stores don't even have it yet. They're sold out. I had to hunt around. The first time I saw it was a few weeks ago when I went to get a pizza. And I saw them in there, and I said to the owner, "Have you ever tried the new Coke?" And he said, "Yeah." He said, "It's really good." So I took him at his word, and I bought it with my son and had a couple of slices of pizza, and he was right. It's absolutely delicious. The problem is when you're a transgender woman, you shouldn't be drinking a lot of soda. That's why I also have water. Water is much healthier and better for you. Plus, you're supposed to drink a lot of water during the day. So I need to do that. I want to lose weight, especially because I want to do this surgery. And ideally, I'd like to lose between 30 and 40 pounds. It's not going to be easy, but I guess if I set that as a goal to coincide with the hopeful date my surgeon has proposed, which is sometime in August of this year. So I'm really kind of looking forward to it, and I'm keeping my fingers crossed that I'll get the surgeon go ahead, with the most important thing being the approval from the health insurance company. The first 2 times I was scheduled to do the surgery, I got approval both times to do the surgery, but unfortunately the surgeries were postponed. So now I don't have the same insurance through my wife because she changed jobs. But she said she's going to put me and our son on her health insurance with her current job. And I hope that that happens, and I hope that the surgery will be approved. Because if it isn't, I'm going to be very disheartened, heartbroken. I don't think surgery is the end-all be-all to being a female, but I would be disappointed because I really want to feel totally feminine and be completely feminized. As a transgender woman, most would agree with that. And I've have several transgender women friends, and most of them I know have had the surgery and they're very happy. The only thing I'm worried about with the surgery is because of my age. I'm not young anymore. You know, if you're 17, 18, 19, 20, early 20s, even 30, it's not as, well, it's traumatic. But when you're younger, you still have a lot of years to live as that like from male to female, you still have a good amount of time to live as a woman with surgery. But I'm nearing, I'm 58 now, so I'm pretty old. But I guess I'm not that old that I can't have the surgery. So I'm hoping everything works out, because I do want to have it. I know I'm a little nervous about the pain that I will most likely experience. And I don't know, there's something a little hard to reconcile in a way, because if it wasn't for my anatomy, I wouldn't have my son. So now that I'm doing away, not actually doing away, but having that vestige of maleness basically changed to represent a woman's body, it makes me feel somewhat like, how do I say, like I'm betraying my family. But the truth of the matter is I don't have a sex life anyway. My wife and I stopped having sex when our son was diagnosed with autism. So I wanted to have a son and a daughter, but no little girl in our life. But we have a son who we love. He's now 20. I can't believe it. But he struggles because he's autistic. And that was the reason why my wife wasn't really wanting to have that risk of having another child and being diagnosed with autism. It was too much to risk. The problem is that our son wished he had a sister or brother, so I feel guilty. But I can't beat myself up all the time, you know? You know, just like I feel guilty being transgender. It's not like I asked to be this way. I'm just trying to cope. You know, when I came out, essentially things didn't work to the way I wished they would. I lost my job, so that affected me big time. And then when I was hospitalized, in the wake of losing my job, I was diagnosed with bipolar disorder. And I was going to a psychiatrist. After I left Bellevue, where I was there for almost 2 weeks, they hooked me up with Mount Sinai, with a psychiatrist and a therapist. And little did I know, I don't see them anymore. There was so many changes through the years, but I'm still with Mount Sinai, seeing a psychiatrist, and I go to a therapist in Long Island. Mount Sinai I go is in the city, and I want to stay in this program with them because they have a transgender clinic, and they prepare their patients for the transgender surgery. So when I was going, prior to being in this program with Mount Sinai, I was still in Mount Sinai system, but they hadn't had this transgender program yet. So basically, after seeing my therapist for a number of years, he kind of surprised me and he said, I'm moving on, so we can't see each other anymore. So I was kind of disappointed, but he wrote me the letter for the surgery, and he said that they're doing the surgery now, so I was excited. Now it's been 3 years, and I'm still waiting to do the surgery. I'm wondering what it's going to be like going through the surgery and being on anesthesia for like 6 hours. You know, you have your jitters. It's normal. But I'm kind of looking forward to it with some trepidation. but I think that it's worth it. The only thing is that it's going to be recovery time, and then I'm going to have to dilate for the rest of my life, because once you have that kind of surgery, it's a wound basically, even though it's now technically similar to a woman's vagina. It's still considered like a wound, an opening. So the normal reaction of the body is to heal the wound. So basically what my surgeon told me was, you need to use the vibrator, the dilation thing, whatever you want to call it, to keep that opening from closing up. So you have to be very strict with your dilating on a regular basis, and you have to do that like 3 times a day. And everything's going to be explained to me in detail. I'm just saying what I know from my conversation with my surgeon. It's been tough. I'm not going to lie. I've been through a lot. I've been in the hospital multiple times. Police have been at my house for various reasons, like if I'm on the phone with somebody and I threaten that I'm going to hurt myself, before you know it, the police are knocking on your door, take you to the hospital, get you an evaluation. And I've been in the hospital too, several times, admitted. It's hard though, because I'm not going to make excuses, but mental illness, unfortunately, is in my family dynamics, and also suicide. Sadly, I lost my mom to severe depression. She also had paranoia, schizophrenia. My father also suffered from depression and alcoholism. My mom died when she was 50. She was in between a psych hospital and a regular hospital because she stopped eating. So they hooked her up on tubes, and it was hard to see that. I could tell my mom didn't want to go on anymore. It was devastating. It affected me up here. My mom died in 1990. I was in my late 20s. My father was very loyal to her. And he never, when she passed away, he kind of shut off. He lived 19 years longer, but he was very loyal to Mom. Sadly, my dad took his life. He couldn't stop drinking, and the pressure with his work as an iron worker, he saw a lot of death. His father and brother got hurt in the business and eventually died through their injuries. My father had many injuries. He even witnessed one of his friends, where my father was actually in that situation where he was trying to rescue his friend who slipped. Unfortunately, my father couldn't hold on, and another iron worker grabbed my father and pulled him back to safety. But my father lost his friend, slipped through his hands, and my father was never the same after that. My mom and dad were good parents, and I feel sad in a way that I couldn't tell them what was going on with me. But I couldn't because they had their own battles and struggles, and so I left it alone, kept it to myself. I did come out to my two sisters when I was in my early 30s. I wrote a little note and put it into a Christmas card for my two sisters and my best friend, a guy I went to college with. And I told them that I was not happy with the way I was living. I said I kind of knew all along that I was not happy at all. And I said I wanted to be a woman. I feel like a woman. The problem was that they didn't really want to talk about it. So I tried to come out, but it didn't really go anywhere. Then I was going to a therapist to deal with my mother's tragic death. My dad was still around, and I lived with him for quite some time. I was not like my sisters in the sense that when they reached a certain age in their 20s, they moved out, they had boyfriends, and their lives were devoted to work and being with their boyfriend or husband, whereas I was pretty much alone. And I was trying to figure out how to explain to a therapist what I felt inside. And I opened up, I said, I'm transgender, male to female. The thing is that my therapist kind of made me focus more on meeting a girl than focus on transition. And 2 years before I went to see her, I drove down to Virginia in search of meeting this surgeon that I found on the internet who did male to female transgender surgery. And I drove down there. I stayed in Norfolk. And I wasn't out yet. Basically, I wore men's clothes. In this case, I did have girl clothes on, but that was underneath my male clothes. And when I met with one of the doctors, a woman, she said, "Are you sure you want to do surgery? You're not really presenting as a woman, and your outfit is kind of what is the word? Why can't I think of it? I don't know. It's like when your clothes can be considered male or female clothes. I can't remember the name though. But she said that if I wanted to do the surgery, they'd be willing to accommodate me once I got letters from a therapist and a psychiatrist. But I wasn't really ready. I think I was just more trying to learn what it was all about, but I didn't pursue it. So after I left the facility, I drove down to Florida and hung out at Disney World for a couple of days. And then I drove home. And I told my therapist that. She listened, but I guess for some reason she really wasn't helpful in guiding me to that path of transition. And so basically I was introduced through her to my wife-to-be at the time. I didn't know that we would marry, but we hit it off. And then I kind of felt if I could make it with a girl, then I wouldn't have these feelings. After going out for like 6 or 7 months, we were married in a civil service. The problem was I was still living at home. So now I had my wife and me living in the house with my father. I remember when my wife was rummaging through the closets, she saw a lot of women's clothing. And I kind of said, oh, that's my mom's clothes, but in reality it wasn't, it was mine. But I couldn't tell her that. So I kept it a secret. And then, for the very first time, we had sex, so I lost my virginity. I was 37. My wife was 29. And wouldn't you know it, 9 months later, we would have a child, a beautiful son. My father wanted us to have a nice wedding. So when we learned, after we had planned the wedding for November, we learned that my wife was pregnant. So when we did the math, and the doctor said her due date was sometime in December, if I remember, he said December 25th, Christmas. So it was actually a woman doctor. So we had to reschedule the wedding, church wedding, with a reception from November to September. And we had a good amount of people that came, roughly 100 people. My father paid for it all. He is great. He helped us a lot. My father was a good man, and I know he missed Mom, and we all did. But he tried to do the best he could. He was very loyal to my 2 sisters and myself and my wife and my sister's husbands and the children, the grandchildren. And that was a big part of his life. Once he retired, he got to spend his days with his grandchildren and us. And he got to know Matthew. And despite my son's diagnosis of autism, my father dismissed that and said Matthew can do anything he wants. And they developed a wonderful grandfather-grandson relationship. Unfortunately, my father was depressed and he took his life on April 16th, 2009. We're actually coming up on the 10-year anniversary. And we're also coming up on the 29-year anniversary of my mother's death. So March and April are pretty difficult for me personally. I still wonder why my dad did what he did. He went to the train station. He took his life at the train station. He jumped right before the train came in. My brother-in-law had to go to identify the body, and it was my dad. Obviously, he had a closed casket funeral. That was awful. And then my best friend, who I met when I was working in a CPA firm, and I used to go to Connecticut to the client, and he was their bookkeeper. And we struck up a good friendship. He was the first one to talk to me in the wake of my father's tragic death. And he spent hours with me on the phone. And he was the first one to want to listen and help me through. He was great. He introduced me to a lot of music bands. He was always into music. And he taught me, he actually guided me to watch some videos. He got me into the group Kane from England. One of their songs is Somewhere Only We Know. He got me into Vampire Weekend. He was a good guy. And I remember when he became a father for the first time. His wife gave birth to a beautiful baby girl. 2 years after my father's death, when I was working in an engineering firm that was the client of the CPA firm I used to work at, one of the auditors came to me and said, Moses passed away. And I was in shock. He was only 40. He died of sleep apnea. His wife was the one to discover his body. They were in bed, and she went to wake him up to go to work, but he didn't wake up. He left behind his wife and baby daughter. He was only 40. And that was in 2011. When I went to the funeral, not the funeral, the wake, and I saw his body, I couldn't handle it. he was a beautiful person, and he and I were good friends. It affected me deeply. And then when I got home, it was hard. And I felt so bad for the daughter. And we were good friends. We used to exchange gifts at Christmas time. So what I did was I went to the mall and I bought some nice toys for the girl and a couple of outfits. And I saw that the mother would get that. It was the least I could do. And then my life took a turn. Losing my parents, my father, my mother, and then my best friend. It made me realize, look, we don't live forever. And I said to myself, you're not happy. What will it take to make you feel better? And I was watching videos on YouTube, and I happened to come across these male to female transition videos. And I said, you know what? I gotta talk to a doctor, because I think I'm transgender. It was tough. I had to come to that realization. And here I was married. I am married with a son. And I didn't know what to do. When I was seeing my therapist at Mount Sinai, I told him everything. The psychiatrist, I didn't really go into depth with, but I told her. And the therapist and the psychiatrist worked together anyway. So whatever I told the therapist, it was communicated to the psychiatrist. There's no confidentiality with the team. They freely discuss what's going on with their patients. So after seeing the therapist for 3 years, I asked, when I knew that they were starting out this transgender program, I said, I need to get into this. And I said, can you write me that letter I need? And also the psychiatrist. So they wrote a joint letter, actually. And in the letter, they explained my history of hospitalizations. And they explained my transgender situation. And the conclusion in the letter was that I was fit for surgery and that I identified as a woman. It felt good when I read all that, because I knew that was what was going on with me. And I felt somewhat relieved. And the problem is, what do I do with my family? What do I tell them? And that's the hardest thing. Well, anyway, when I gave that letter, it was instrumental in me getting through that process. I met with the surgeon, for the first time. And the first meeting they set a date. And I was looking forward to it. But it didn't happen because of my back then, my hospitalization at a psych hospital. So the surgery was postponed. I took it in stride. And then a year later, I went back to a surgeon. That's Rajveer Purohit. The first surgeon that I met with the previous time was Dr. Jess Ting. They're both affiliated with Mount Sinai. And the second time, they had a great team. They had Dr. Rajveer Purohit. They had Dr. Jess Ting and Dr. Marcy Bowers. So I was excited. I said, wow, I'm getting the royal treatment. But then stupid me goes and gets a man's haircut due to family pressure. And I couldn't wear women's clothes anymore. I called my psychiatrist. I was messed up. I said, I can't do the surgery because I don't look like a girl anymore. It was terrible. And I thought that was it. I just accepted the fact that I'm probably never going to have surgery. And when I went to the psychiatrist, after making that decision, I came in with my short hair and I was wearing men's clothes. And I said I made a mistake. I need to start to go back to what I wanted. And I said, is there any way, looking the way I do now, not here, but then, is there any way that I can get back on track? And I asked him point blank, I asked him, do you think, given what I look like, then that I can still go out and wear women's clothes? And he said, yeah, why not? So I didn't care what I look like anymore. I just said I can't wear men's clothes. I can't do it. I can't use the man's bathroom anymore. So I did what I had to do. I tried to make myself look as feminine as I used to. And I wore women's clothes again. After 2 weeks of wearing the other, and I didn't like it. And then luckily, after a few months went by, my hair started to grow. And I went to my hairstylist and I said, look, I'm not happy the way I look right now. Can you please get my hair to look like it used to somehow? So she said, the first thing we need to do is to color it blonde again, since you were happy with that. I said, let's do it. And I was happy. What she did was she colored my hair blonde, and she gave my hair volume, even though it was short. I wasn't thrilled with the way I looked, though, because I was so happy when I had the long hair. But it was a start. Now when I take pictures, I feel a little better. When I got my hair cut, I didn't take any more pictures, only a few. But I wasn't like doing the selfies like I used to. then, about 8 months after canceling out on the surgery, I called Dr. Rajveer Purohit, and I said, look, I need to do this surgery. What do I do to get back on track? He met with me and he said, let's do it. So right now the surgery is tentatively, they didn't schedule it obviously, but they're looking at doing it in August of this year, 2019. The problem right now that I have is my 3 doctors that I see. My primary care physician, my psychiatrist, and my rheumatologist, and my endocrinologist. All came back with the same concerns. They said I have high liver enzymes. And my doctor said, do you drink? And I said, no. The only thing I do is I take my medication. And so my primary care physician and my psychiatrist, after looking at the blood results, worked to decide that I should come off a lot of my medication. So they took me off quite a few: Depakote, Risperidone, Seroquel, Lexapro. So now they only have me on lamotrigine, benzotropine, and my hormones, estradiol and spironolactone. That's all I'm taking now. I used to take like 12 different medications at one time. Now I'm down to 4. And they're monitoring my blood, my liver function. They even had me do I don't have a good memory anymore. I'm almost wanting to say sonogram, but that's not. That's for a woman who's pregnant. Ultrasound. They did an ultrasound, so I'm waiting for the results of that. But when I was in Nassau University Medical Center recently, they also did an ultrasound. I don't know what the results were there. I should get the medical report. So now I had the ultrasound and we're waiting for the results. And I'm keeping my fingers crossed that everything will work out. I don't want to miss out. I feel I have a very limited window of opportunity now to do the surgery, and I would be heartbroken if I couldn't do it. I need the insurance approval and the go-ahead from my psychiatrist, my therapist, and the surgeon. Another thing they're concerned about is my thyroid gland. So I'm working to do what I have to, whether it's diet, questions about medications, whatever, and listening to my doctors. I also have arthritis, which is not pleasant. I have a great rheumatologist, though, so he's helping. So, here I am. I'm not working either, by the way. I'm out of work for quite a while, and that's affecting me up here. I am going to Access VR, though. You know, it's ironic. It's ironic because I worked 35 years as a guy, in accounting and working when I was in college. And I never had a problem. My employers liked me. They knew I worked hard, even though I was shy. The minute I came out, it's like they pulled the rug out from under me. I was the same person, but they didn't want to deal with it. When I said I wanted to transition to become a woman, they wanted no part of that. So I wound up losing my job, losing my self-esteem. And all I wanted was to work as a female and be accepted. And I'm happier. But how can you be happy when you're not part of society anymore? I feel abandoned, isolated, and I have a son who's going through the same struggles as an autistic young adult. And so all this is weighing heavily on me. And sure, I have concerns about the surgery. You know, it's only normal. And then the recovery period, from what I understand, is going to be like a month or so. And then dilating. So it's not easy. The one thing I like, though, is that I can go out now, not feel self-conscious. And my hair is growing. It's going to take a while to get back down there, but I let nature take its course. This is a longer video than I had expected. I see I'm past the 1 hour mark. I don't think I ever did a video this long. I think doing videos where you don't read from a script is much better. You know, it's more like down to earth. And people can see my desire and sincerity. And I do wish people well who are transitioning, male to female, female to male. I wish them much success. I have some male to female transgender girls I'm friends with, and I have a couple, well, one female to male that I'm good friends with. And a couple of my male to female transgender girlfriends don't even look like women yet. They're in that process where they want to do it, but they can't because of their job or whatever and their family. So inside they feel like women, but on the outside they look like men. I couldn't do that anymore. I had to make my appearance look as feminine as possible to match what I felt in here and here. And I'm looking at surgery as like the pinnacle of my transition. I don't really think about sex. I'm not doing this so I can start having sex with men. That's not what I'm looking for. I just want to be me, happy as a woman. If you want to learn more, I suggest you speak to a therapist, psychiatrist, go to your library, join a support group. You can't take it on by yourself if you're going through this confusion as possibly transgender. Just like I did. Took me a long time to get here, but I'm now here and I know what I want. I can't look too far into the future because it only gets me sick. Luckily, I have some social safety nets with my disability income. So I'm going to try my best to do some video updates, and I would like to chronicle my surgery. That's my wish and goal. My goal is to go into the surgery, be put out under the anesthesia, have a successful surgery, and when I wake up, my surgeon and his team of doctors and nurses and assistants surround me in my bedroom and say, "Congratulations, you are a woman now." That's what I wish for. And also to be accepted by family, friends, and a work environment that will be conducive for me as a transgender woman. So that's my little story. If you need to ask a question, you can leave me a comment. I'm on Facebook under my male name, Edward Iannielli. I used to have a female page, but I got in trouble because I was doing music videos in Facebook, which I shouldn't have done. I should have done it through YouTube only. But they flagged my videos for copyright. I got a few warnings. I didn't realize the severity of it, but they took down my page. And I can't change my Edward Iannielli page to Emily Iannielli, and so I have to live with that. I haven't even changed my name legally. On my paperwork, it's in my male name. I guess I will say goodbye for now. Thank you for listening if you do. I hope so, because my videos don't really gain or garner any much attention. I've seen videos with other transgender women, and they got lots of views, lots of comments. Here I am pouring my heart and soul out to the public through this video. And I hope that people find it, because I think we all learn from each other's stories. And I hope I somehow touch someone out there. It's not easy, believe me, but you can do it if you feel it's the right thing for you. There are going to be some repercussions. Not everything is smooth in your transition. So you just gotta live it one day at a time and try to deal with that. I wish everybody good luck. This is Emily Iannielli saying goodbye for now. Love you all. Thank you.